So I'm gonna ask this question to you, Eric. It's actually a very good question. It's very topical. I'm actually really, the questions that we get today and all along really reflects how educated and up to speed the IBD community is. And so the question here is there more information regarding the pediatric multisystem inflammatory syndrome, the Kawasaki disease, that is potentially associated with COVID-19 in children? And I wonder if you wanted, that's relatively new data as well, and if you could talk a little bit about that.
Yeah, absolutely. So, this is a scary thing for a pediatrician and for a parent, hearing that, up until now, we really felt that kids did very well with COVID-19 and tended not to get sick, almost never needed hospitalization, and almost nobody died as a child because of COVID-19. And then this comes out. So these were cases that initially, I think, New York City and area reported about 100 cases. And now we just had a published report in the Lancet yesterday from Italy, which looked at something called Kawasaki disease. And this was a Kawasaki-like illness. Kawasaki disease is a very well-known pediatric illness. It's not common, but it's an immune system disease that's usually triggered by an infection, we think, although we don't always know what that infection was. And it results in an inflammatory state, not unlike IBD. It's sort of triggered by something that sets off the immune system, and the immune system produces inflammation, and that causes damage to your body. In this case, the immune system is reacting and causing a vasculitis, which means inflammation of the blood vessels. And we're very good as pediatricians in identifying Kawasaki disease, which there's no test for it. It's really identifying the symptoms of it, like having red eyes, having peeling hands or feet, having a rash, and having a fever lasting longer than 5 days. And we can treat it. We use medicines, we use immunoglobulins, actually intravenous immunoglobulins, to boost almost your immune system. And it helps prevent the complications of Kawasaki disease, which can include coronary artery aneurysm and inflammation of your coronary vessels, your blood vessels of your heart. So what they've found with COVID-19 is there seems to be an increased risk of something that looks like Kawasaki disease. So it's Kawasaki disease-like illness. It's a systemic inflammatory disease. It has similar features like the coronary artery problems and the red eyes and the rash and the fever, but it also results in almost a toxic shock where your body shuts down, your blood pressure drops, and you get very, very sick, and the child gets very, very sick and can die from it. And so this Italian study that came out yesterday found that the rate of what looked like Kawasaki disease jumped very, very high during the time that COVID was very prevalent in northern Italy, and much higher than it had been in the year prior, implying that COVID may be related. And similarly, we've seen that in Montreal, and we've seen that in New York, that there are case series of these kids who get very sick with this vasculitis illness, this Kawasaki-like illness. It's still very rare. It's still very, very uncommon. Again, you saw the graph that Gil produced, that most children, 98% of them, don't need to be hospitalized. Very few, if any, have died in Canada. So it's not something to panic about, but I think it's an indication that we know very little about this virus and the effects that this virus has on the body. And we need to be really, really cautious with treating it lightly. I'm not saying that we shouldn't slowly reopen. I think we all agree that, the economy has to reopen. This is going to be a long-term thing, but we can't say for sure that all children will be fine. It's not the flu, it's something else. And we don't understand it yet. We don't quite understand how to treat it. We don't know how to prevent it, and we have to be really careful. So, that all to say, don't be too scared about it. It's very rare. Make sure your kids wash their hands really well. Make sure if they're going to be back in school, if you're in Quebec, really, if you're going to be back in school, that they wear a mask if possible, that they stay 6 feet or 2 meters away from their friends, and that they come home and they wash their hands really well. But beyond that, we're still learning all about this.
Yeah. And the only thing I would add is that this is a new disease, and so we're going to learn new things week to week. And that's one of the reasons why we wanted to do this webinar, because on a weekly basis, because we know that if we were to come back a month from now, we would essentially leave the community in an abyss without that extra knowledge. And so we're working on this, but it's not just us alone. There is a huge outpouring of research from the entire world. The Canadian government just announced over $1 billion in funding related to COVID-related research, including our Canadian Institutes of Health Research, CHR, is the #1 national funding agency for health research, and they just launched a COVID-specific grant competition that Eric and I put in a grant application to study COVID in the IBD community, to try to answer some of the key questions that you've been asking. Again, we don't know if we're going to get funded or not, because there's, I think, 2,000 applications that are all there, but it just shows you, if we didn't get funded, it means that there's X number of studies being done by brilliant people across the country that have ideas even better than Eric and I. And that just shows you there is a tremendous amount of effort going towards trying to answer the questions that you're having.